My name is Erica Juarez, and I'm doing my speech on alcohol and your health. Alcohol is addictive and damages the whole body. Alcohol is the oldest and most abused drug in the history. It is a depressant, which means that it slows the body's processes. Alcohol affects many of the body's organs and slows their function, including the heart, stomach, liver, and brain. Alcohol affects the parts of your body that are controlled by your brain. BAC means blood alcohol contraction. If a person has 2 or 3 drinks in 1 hour, it affects most of the cerebrum, judgment, reason, senses, coordination, vision, and speech. This amount of alcohol affects driving skills. The active ingredient in alcohol beverages, a simple molecule called ethanol, affects the body in many different ways. It directly influences the stomach, brain, heart, gallbladder, and liver. It affects levels of lipids, cholesterol and triglycerides, and insulin in the blood, as well as inflammation and coagulation. It also alters mood, concentration, and coordination. Only time can cause a person to become sober. The liver detoxifies half an ounce of alcohol per hour. No matter what, coffee, Red Bull, or cold shower will not help. Caffeine with alcohol can cause the brain to send conflicting signals to organs such as your heart and your lungs. Stimulants and alcohol combinations can lead to heart or lung failure. Other complications include digestive system problems, ulcers, and if you're taking any painkiller medication and drinking alcohol, you may be at risk for very serious liver damage. Alcohol particularly affects all symptoms in your body and can cause lifelong damage. The route taken by alcohol during consumption starts in the mouth and esophagus. Alcohol is diluted by saliva before being swallowed. 20% of consumed alcohol is immediately absorbed through the stomach walls into the bloodstream before reaching the rest of the gastrointestinal tract. Alcohol is an irritant to sensitive lining in the esophagus. In the stomach, more alcohol is absorbed and irritates the lining of the stomach, increasing acidity, leading to some symptoms commonly associated with a hangover like nausea, vomiting, and diarrhea. Any remaining alcohol is passed into the small intestine, which is the site of most alcohol absorption. Alcohol quickly diffuses through the body's bloodstream, affecting almost all cells. Different tissues absorb alcohol at different rates. In the brain, the cells are most susceptible because they are usually protected. People with higher percentage of body fat will absorb alcohol less quickly, lengthening the time it circulates into the bloodstream. Women psychologically have higher body fat percentage than men, typically increasing the impact of alcohol on their bodies. Body size is also a factor. The smaller the body, the more concentrated the effects will be, because alcohol will be a bigger proportion of the bodily fluid in a smaller person. The faster the consumption, the faster the absorption. Carbonated beverages also increase the rate of absorption, including champagne, wine coolers, and drinks made with soda. Alcohol is processed by the liver as it arrives from the bloodstream. The liver produces enzymes called alcohol dehydrogenases, ADH, and aldehyde dehydrogenases, ALDH. Alcohol metabolism via ADH produces a secondary product more toxic than alcohol itself, which is acetaldehyde. Acetaldehyde is then converted into acetate by ALDH. Acetate is digested into the fatty acids, CO2, and water. Fatty acids, when digested, create 7 calories per gram of alcohol, and that's where the beer gut comes in. Excessive consumption can also cause people to be unable to form memories during consumption. Alcohol depresses the central nervous system, causing increased self-confidence as well as decreased judgment. The emptier the stomach, the faster the absorption. The greater the impact, the more pronounced the side effects. Alcohol affects urination. It is a diuretic, causing cells to shed water. Alcohol interferes with water reabsorption in the kidneys, causing excess water to be moved to the bladder. Alcohol also causes loss of balance due to the thickening of endolymph fluid. Endolymph fluid is filled in the semicircular canals in your ear. The sensing system responsible for sensing movement is now less sensitive, causing stumbling and loss of coordination and balance. Alcohol also causes flushing in the face. This is due to an excess of acetaldehyde in the body, a decrease in the ALDH enzyme, or both. Because acetaldehyde is more toxic to the body than the alcohol itself, it can cause inflammatory response similar to injury or infection in the skin blood vessels. Alcohol has different effects on people. It can cause a person to be angry, frustrated, emotional, or happy. It can cause health risks like fetal alcohol syndrome, heart disease, liver disease, pancreatitis, cirrhosis, alcohol hepatitis, anemia, dementia, depression, gout, seizures, nerve damage, and various types of cancer. Heavy, long periods of drinking bring up most of these health issues and diseases. Symptoms of these diseases are an abnormal pain, yellow coloring in the eyes and the skin, and urine, fevers, nausea, vomiting, and including death. Alcohol hepatitis can lead to death. Cirrhosis is not curable but can be involved with transplantation. This causes scarring of the liver. Fetal alcohol syndrome is when pregnant women drink while pregnant. The unborn child shows signs of physical and mental loss at birth. Pancreatitis, inflammation of the liver, gives off majority pain. Major abdominal pain and weight loss can turn the fatal fate. Drinking alcohol by adding high blood pressure and chances of having a stroke or heart attack increase the likelihood of having a heart disease. Heavy drinking can cause the number of oxygen-carrying red blood cells to be abnormally low. As people age, their brains shrink, on an average at a rate of about 1.9% per decade. That's considered normal. But heavy drinking speeds the shrinkage of certain key regions in the brain, resulting in memory loss and other symptoms of dementia. Heavy drinking can cause epilepsy and can trigger seizures even in people who don't have epilepsy. Heavy drinking can cause a form of nerve damage known as alcohol neuropathy, which can produce a painful pins and needle feeling or numbness in the extremities as well as muscle weakness. Cancer is also advanced in many different areas. There are so many places where you can get it because of the variety of areas of alcohol effects. Cancer can be the following regions: throat, mouth, voice box, liver, breast, colon, and esophagus. Alcohol also affects the nervous system. It weakens your muscles and makes you fatigued. Moderate consumption of alcohol, less than 2 drinks per day, by legal adults can actually improve heart health by lessening the work required to pump blood. Most adults can't just have 1 or 2 drinks. Once started, they continue and lose count of how many they have consumed. The most common way of treating drug and alcohol addiction is rehab. Here's my visuals of alcohol, the route it goes, and my